All right, everyone, welcome back. I hope you enjoyed your lunch and had the opportunity to connect with your fellow attendees. For those who might just now be joining us, my name is Allison Jones, and I serve as the Director of Program Strategy and Management here at the Alliance for Health Policy, and I'm so honored to host you all today as part of our Aging in America Signature Series Summit. With that, I'm so pleased to introduce our next panel, Autonomy and Aging Policy, Leveraging Behavioral Economics to Empower Early Decisions. I'd like to welcome our panelists. I hope you'll join me and introduce Dr. David Grabowski, professor at Harvard Medical School, who will be moderating today's discussion. And so if you can find David's bio along with the bios of our other panelists in our digital program using the QR code on the printed one you have on your chair. And with that, I'll turn it over to you.
Great. Hi, everyone. Good afternoon. Hopefully everyone had a great lunch. It's good to see a lot of familiar faces around the room. So we're going to have a robust discussion about behavioral economics and aging. Let me start by introducing my fellow panel members. So all the way to my left, Sarah Zeff-Geber is at Life Encore. She wears a lot of hats there. She's a certified retirement coach, a speaker, as we're seeing today, an author, and a consultant. To her right is Joe Antos at the American Enterprise Institute, where he's a senior fellow. And then to my left here is Aparna Mashur, where she's at Amazon, where she's a senior manager in economic policy. So, and I'm going to wear a couple of hats here. I'm both going to be a moderator and a speaker, so I'll probably jump in a lot more than most moderators today. But I want to kick us off here with a very kind of maybe an icebreaker of sorts. And Sarah, why don't I start with you all the way at the end there? And I want to start with a broad question. What's missing? Today we've had a really great discussion about aging, but what's been missing in today's discussion and most discussions about aging?
I think the thing that has been missing for a long time is a discussion about something I call solo aging. And the reason I think it has been missing is because it's not something that's immediately obvious, but I'm sure everyone here has a solo ager in their family, if you aren't one yourself. So if you take a look at this graph, you'll see over on the far right-hand side, the light blue bar represents the generation before solo agers. These are people who are essentially 80 and above. And then when you get to the middle bar, that's the early boomers. And then the large bar on the right is the late boomers. Now, the numbers that you see here represent those people who do not have children. This is a study that was done in about 2021, right in the middle of COVID, by the Census Bureau. I guess they didn't have anything better to do, so they took a look at their data and saw that, let's say, let's measure the childless rate and among the boomers. So they did. Now, you'll see, without studying the graph very hard, you can see that that rate doubles between the previous generation, the Korea generation or whatever you call them, and the boomers. So in a nutshell, almost 20% of baby boomer women, did not have children. Now, some of them went on to adopt, etc., but that's a lot. And when you add to that the number of baby boomers who have children, but they may be estranged from them, they may live on the other side of the globe, you have a lot of people in that group. So I asked myself at one point, I don't have children, and I looked at some of my friends who were in their 60s starting to spend a lot of time taking care of their aging parents. And I said to myself and to some friends of mine, who's going to do that for us? So that's what I call solo agers. How many in here would consider yourselves solo agers? Yeah, there we go. Okay.
Thank
That's
you.
all I have to say for now.
I'm sure we're going to hear more about solo agers here, but thanks, Sarah. That was great. Joe, what's missing from the discussion on aging? And Joe's already smirking here, so brace yourselves, everyone here.
No, I'm going to try to be serious for this one question. So, we're in Washington, so I think in the context of federal policy discussions, I think one of the big things that is largely absent from serious policy discussions is the total lack of coordination across the various programs at the federal level, much less coordination between federal programs, state programs, local programs, and so on. I think everybody is nodding their head. Many of us have experienced that lack of coordination. But I think it's worse than that, because even within major programs, it's often very difficult, and this has been true for a very long time. It's not new this year. It's been very difficult for the average person to understand what the rules are, how do you access the services, are you eligible, those kinds of questions. How do you apply? All these things are very difficult to do. This is not a new thing. This was not invented by the Trump administration. Believe me, HHS has had this down pat for many decades.
Great. Aparna?
Yeah, thanks. I can tack on to what Joe said, though I have a different point to make. Like in general, looking at public benefit programs, you see just a general lack of coordination across, different agencies, requirements, eligibility rules, and so on. I think the point I want to make, I want to put on my economist hat, and this was something that struck me, I think, a decade ago when I was just doing research on economic mobility and so on, is just how strong the older workers, the presence is in the labor market. So if you look at even the population today, they're about 20% of the workforce. If you look at people who are age 65 or older, their labor force participation rate has gone from something like 11% in the 1990s to 20%, in 2023, 2024. For people who are 75 and above, their labor force participation rate has gone from 4% to 9 to 10%. The BLS, the Bureau of Labor Statistics, is projecting that about 57% of the entire labor force growth over the next decade or so will be amongst this, population. And so to me, it's really surprising, when you think of older people, you don't think of older workers, right? And I think what's changing today is just how many of them are still planning to continue to be in the workforce for several different reasons, right? Like we know people are living longer, people are living healthier. There's some interesting data that says that in the 1980s, if you were 65, you probably expected to live 12 to 16 years. Now you can plan to live for 19 to 20 years, right? That's a big change. So people are living longer, people are living healthier. I think we also have a more educated, older workforce. And given the changes in the economy, where we have more service economy jobs, more knowledge-intensive jobs, I think it also makes it easier for them to stay on and continue to contribute. And I think finally, yes, there's financial need, but there's also a sense of purpose and meaning that comes with, having an attachment to the workforce. So I think for all of those reasons, it really struck me that, we used to talk about the baby boomers being sort of the true workforce generation, and they're still sort of continuing to participate at really high rates, and the employment rates are pretty high as well.
I love all three of these answers to this question. Let me offer my own. I think what's also missing, in addition to the workers, coordination, solo aging, those are great topics. We need more planning around long-term care. Nobody wants to sort of invest in middle ages in thinking critically about this issue. I always have this experience. I'm sitting on an airplane. The person next to me asks what I do for a living. I study long-term care. It elicits one of two reactions. The first, they can't stop talking to me soon enough. They start reading their pretzel bag intently, and they want nothing. And I get the hint usually and stop talking. The second reaction is one of they want to tell me about their parent usually and the experience they had in the long-term care system. What rarely happens is that somebody wants to tell me about their own planning for long-term care. And I think it's because very few of us have a plan for long-term care. Nobody, ever thinks about their preferences. Nobody ever thinks about where they want care. Private long-term care insurance, that investment is complicated. Sometimes people ask me about that, but for the most part, people put it off. And I think there's a lot of good explanations for why people put it off. Fear and anxiety. It's expensive. It's complicated. We're generally myopic. There's a lot of uncertainty. Will I have a family member? In often cases, no. So what's missing is really kind of ways to overcome this. And this is a session about behavioral economics. In areas where we can't make these decisions ourselves, where we're unwilling to invest, there might be an opportunity to kind of push people. And I'll just give one quick example. The state of Washington, incredibly innovative. They're the only state right now with a public long-term care insurance program. It's not huge. It's a payroll deduction, so it's not that I have to put aside money for my long-term care. It's actually deducted from my payroll. It's a tax. It's a cash benefit. It's a front-end coverage, so it's not catastrophic coverage, but it's something. And it's that kind of nudge that getting people to sort of invest in their long-term care. It's not clear any of us, whether it's the person I'm sitting next to on the plane, or one of you, or one of us, has a plan in place. And so it's these kind of programs that I think can really nudge people towards investing in their long-term care. So that's a good segue into my next question. It's for you, Aparna. Given where you sit at Amazon, I think you're incredibly well positioned to answer that same question or that same issue from another perspective. What role can employers and the private sector play in encouraging earlier conversations about aging and caregiving?
That's a great question. In fact, I think a lot of companies are following what we have learned from the behavioral economics literature. I think some of the practical ways that we can help people plan for retirement are, do we allow them, there used to be a system where people had to opt in to setting up a retirement account. Now, I think with all the learnings from behavioral economics, we know that automatically enrolling people, that's the default option. You have a 401k, you have this. If you want to opt out, then that's when you have to take the additional steps. So I think there's a lot of practical things that companies can do to help people plan for retirement. And, most of us are probably enrolled in some kind of plan because of that. I also think that there are lots of financial tools with the investments in Gen AI. We're trying to figure out ways that people can engage, with some knowledgeable AI assistant to say, okay, help me think about retirement, help me think about, how should I think about how many years I'm going to spend in retirement? How much money will I need? What sort of lifestyle do I want, etc. But I think in many other ways, there's a lot more that companies can do. So you start to think about, well, what accommodations would people need as they age, right? Like, can we change the workstations? Are there more ergonomic workstations? Can we think about phased retirement options, which would include more workplace flexibility, right? Like reduced hours, part-time work, telecommuting, having the ability to sort of manage your hours a little better so that you're not just, yes, I'm working full-time, and then the next thing you know, I've retired, right? So you allow people to figure out, phase out over a period of time. There's also a lot of, I think, investment in learning that can happen as people, because like we're saying, not everyone's ready to retire at 55 or 60, right? So there's a lot of new learnings, new trainings that can be done on the job that allow people to stay and be productive. And I think the final point I want to make is, there's a lot of value in having the expertise and experience that comes with technically the older generation in a workplace. And we talk a lot especially when it comes to the labor market, about skills gaps and where are these workers going to come from. And what companies need to realize is that you already have a lot of skills sitting in your workplace. They don't have to retire. They're not ready to retire. And so what kind of mentorship programs can we initiate so that they can start to transfer some of that expertise to the younger generation that's actually coming in? So I think just understanding the value of what we have and how can we continue to support people as they reduce their workload. There's a lot of stuff that employers can do.
Yeah, I love that answer. And I think ultimately, whether we're thinking about the state of Washington or employer, it's going to take a public-private partnership. It can't be on one side or the other.
Absolutely. I think one thing I did forget to mention, what we also see in the data are that a lot of people sometimes have to, abruptly stop working, in the middle ages, but then they're ready to come back. And I think what I've started to see Amazon do more is these return to work or returnship programs where people can ramp back, come back to the workforce and learn skills along the way. So you're exactly right. Like there's a lot of interesting ideas out there for us to hold on to this talented population.
Great. I'm going to skip Joe for now. I promise, Joe, I'm coming back. I'm going to break the not going in order. This is a really tough question, so I want to save it for Joe. I wanted to ask Sarah again about solo agers because Sarah, you're the national, if not the international expert on solo agers, and you already showed us some great data. Sort of a two-part question here. One, what are the most urgent considerations for that group? And then two, given that we're in DC, what do you want policymakers to understand about this growing segment of the population?
I think I can answer both questions really in the same way. I'm going to make you crane your necks again to look at the screens in back of you. This is a pie chart I put together based on my own research and my own talking to hundreds, thousands of solo agers all over the country, is what are you lacking? And this also took really observing what people who do have kids, what do they rely on those children for? And these are the things that are missing from most solo agers' ability to plan for themselves because they don't have someone kind of as a safety net.
Yeah.
So I think policymakers at all levels should take into consideration that real pure solo agers come in lots of degrees or levels, but a true solo ager who doesn't have any family to rely on as they age needs to make sure that all of these things on this pie chart are taken care of for them in some way. And that usually means bringing professionals in to do it. I know that some of the area agencies on aging all over the country are finally starting to understand this. They're putting together support groups for solo agers. Solo agers can be a support to one another to a great degree. But these are the areas that solo agers really need to face. And speaking of putting together plans for the future, the question that strikes fear into most solo agers' hearts before they kind of realize that they are solo agers is when an estate planning attorney says to them, well, who would you like on your advance directive? Who would you like to speak for you if and when you cannot? And I've had many people tell me they just walked out of the office at that point and decided there was no way they could put together an estate plan because they didn't have anyone. So in a perfect world, there would be some kind of support system sponsored by the government to solo agers. I'm not holding my breath, but that's really the answer to that question.
Great. That's, I think, such a key part. And I think we're going to have like a two-pronged approach, one of like both policies that are broad enough that can suit solo agers, but also some very focused policies around kind of the particular needs here. So I promised Joe that I was going to come back to you, and I am. I want to ask you, Joe, because this is once again a session on behavioral economics. You, as an economist, typically, if we asked everyone in here, like, what do you want? We all want choice. We all want lots of options, and we can see this in lots of stores. Amazon, if I go on your website, it's overwhelming. Yet when it comes to healthcare and caregiving and long-term care, is more choice necessarily better? Is it enhancing? And I think there's a real tension there. Joe, speak to that tension.
Well, I will attempt to speak to that, but let me editorialize. Some of those categories are pretty technical. And I'm not referring to my children. If they're listening in, I'm not talking about you. But you can get a lot of bad advice from very well-meaning friends and relatives about things that they thought they knew. Now, you can also get a lot of bad advice from government officials, but I think friends and relatives are my primary source for bad advice on technical issues, unless I make it up myself. And then, I have to be fair. Aparna, if you bring back all of us older people, I'm not saying older people, we're blocking the road to advancement to all those 20-year-olds if they choose to advance. I think that is a legitimate issue.
Yeah.
And so there's the question always is balance. What do you do about that? Okay, now what was that question again?
It was about choice.
Yeah, choice. So, if you don't have options, then you're not living in, you don't have an autonomous life. And so you need options. The problem is too many is not desirable. People they don't have a narrow bandwidth. But especially if we're talking about complicated options, then the more options there are, the more confusing it is. And so, sort of economics 101 really doesn't apply in this case. If you take it too seriously, if you take it the way I think it's really meant, which is not that there are thousands of options, but rather there are several reasonably good options, and that you can seriously consider what the pros and cons are of each one of them may be. That is really, I think, the situation we all want. We want it simplified, but we don't want the options to circumscribe our decisions so much that we get trapped in a corner somewhere, either financially, in terms of healthcare, or any number of issues. Other standard economic 101 assumptions obviously don't apply in the real world. We all know this. We do not have good information about prices or about a lot of other things that factor into the decisions that we make on a daily basis. This is especially obvious for all of us in terms of healthcare. And the government has tried in its own, I would say, inept way to improve information that might be available on prices, at least. One would think, well, price, that's a number. And, you have a service, you have a price, you can sort of understand what that means. Well, in healthcare in particular, you have a problem with what is that service? I'll pick something that I'm not a physician, so I can't pick something that's realistic, but a typical ordinary medical procedure might have 4 or 5 different variations depending on the patient's state of health, for example. Well, that comes with a lot of different prices as well. And so here's the federal government requiring that hospitals release all their pricing data, and insurers providing pricing data to their customers. The problem is that, of course, the government got it wrong. Hospitals in particular produced and continue to produce computerized files that are generally not accessible and not usable to the average person. And also, the question is, what price matters to me? It is not what the hospital charges. It is not what the hospital negotiated with my insurer. It is actually, what is my copay and deductible? And that depends on how much health care have I had this year. So what we really need to know is something that is not fixed in time, It's dynamic over time. Government rules are incapable of dealing with that. And insurance companies can't really sort it out either because they're constantly readjusting their contracts. And so what is the price? Well, depends on the day. There are a whole bunch of other issues related to healthcare delivery. In particular, an issue that I wanted to bring up has to do with the ability of the medical establishment to adjust to innovation. And in particular, the idea that this is the way we always do it, otherwise known as the standard of practice, is rampant everywhere, not only in the United States. And that's because that's the easy way. It is the innovator who has the tough job of adopting something that may have been proven, may have been very well proven to be more effective than whatever the current standard of care is. But you're deviating from what we always do. And when we always do that, we always get paid. So there's financial barriers. There's also potentially reputational barriers. Suppose you're wrong. Eventually, improvements in treatment do come along, but it is really a very slow process. It's nowhere near as rapid as the technical development occurs.
Mm-hmm.
Great, thanks, Joe. Whenever I make that point to my students about economics not fully applying to healthcare, they always give me that look of like, well, then why am I taking this class? Like, but we tell them there's other benefits, right? I want
unemployment.
The reason I saved Joe for last is I knew he would talk about choice, and I wanted to kind of use that as a jumping off point for my thoughts here. It's interesting. I love the way you frame that, Joe, of options trapping us. I wanted to quickly reflect on, obviously we don't want 1,000 options, but even a few options, sometimes individuals don't always choose the socially optimal one. And so I was involved in evaluating the financial alignment initiative for dually eligible individuals. These are individuals who get their health care through Medicare and their long-term care through Medicaid. These are the most medically complex, most chronically ill, most expensive individuals in our healthcare system. Over time, we've seen a lot of studies suggesting conflicting incentives across the two programs. Joe mentioned coordination earlier. We're clearly not, there's a lot of waste and inefficiency right now in the system because of the way we cover their care. What the Financial Alignment Initiative did was actually integrate the two programs. So you went from having 3 cards to one healthcare card, and you had one insurer, and this was all supposed to work under one unified plan. And what was really innovative about the initiative is that rather than having individuals opt into the program, we passively enrolled individuals into this choice. So all of a sudden you went from just being enrolled in here and you had to opt out. And we thought, well, gosh, this is such a great thing. Most people are going to stick in these models. Turned out most people opted out or later disenrolled. And it turned out individuals really value the relationships they have with their providers. We didn't do a good job with the design of the auto enrollment. There were supply side issues with payment, lots of issues here. But it turns out it's more than just kind of nudging individuals into a plan that we think is better. It's actually offering a better plan. And so choice matters, but also being smart about default options here in terms of care. So we're starting to run a little bit short on time before we open it up for Q&A, but I did want to go through one final question. So I'll ask everyone to be thoughtful again, but short. It's hard to it's easy to be short or thoughtful, but it's hard to be both here. So Sarah, maybe I'll start with you and we'll just come down this way. What do you see as the greatest opportunity to improve autonomy and aging policy over the next 5 years?
Well, since my focus is on solo agers, solo agers many times have, I want to say, too much autonomy. they need to share that a little. They need to be a little more interdependent. So in terms of autonomy, I don't know that it, I think I always use the term agency because in the field of aging, we talked about people having agency, being able to decide for themselves. I think it essentially means the same thing as autonomy. But I think everybody wants to maintain that, solo agers as well. So the more we can do to put the decision-making in the hands of the people who are receiving the care, the better we'll all be.
Joe?
Yeah, so I would add to that collaboration. To a large extent, people learn, I think best, certainly I do, by talking to somebody with similar circumstances who've already been through whatever it is, who can tell me what their personal experience was. Now, they may be biased. It may not be a complete picture of what's going on there. But I think that's the way a lot of people cope with developments in life. And so to the extent that we can promote that, that would be a positive thing. The days of the World War II generation going to the veterans clubs, that's what they were doing. Well, we don't have that now, but we could think about trying to develop that culture again.
And so I'm going to say this a little differently. I think there's a role for federal policy. We've had paid family and medical leave laws on the books for a while, but it's still unpaid leave. So how do we incentivize caregiving for older generations amongst family members? Doing it through tax credits, creating the right incentives, I think can play a big role going forward. It's also interesting to me, looking at the role of tech in letting, older generations sort of be more autonomous. And I'm tracking a lot of interesting developments, right? Like how people can live in their homes a little bit more independently. So you have all these virtual AI assistants, right? Turn off the lights, do my grocery, here's my grocery list. Here are who's at the door. There's just all these smart investments that are allowing that, like Sarah pointed out, there are all these things that family does that maybe we can now start to rely a little bit more on tech to do. Similarly, things like medication reminders or wearables, right? Like, did an older person have a fall in the house? Is there someone who's tracking that? So I do think that there's a role both in terms of changing federal policy, but then also maybe leaning a little bit more on tech where we see a gap in terms of family care and other forms of care.
I share your enthusiasm for tech, and I'll just double down on it. It's not going to be tech alone. It's going to be tech with support of a workforce, and it's going to be the families members and then the paid workforce. And as you look at the number of aging boomers, who's going to care for them, and how do we make those investments? And so I think we're at the precipice here of a tremendous opportunity to kind of double down in both in our investment in family caregivers, but also paid caregivers. It's just there's going to need to be a massive investment, and that's going to need to happen in a lot of ways, whether it's working conditions, pay and benefits, immigration. There's just a lot of potential opportunities here. It's not a simple one-off, but I think we're going to have to really invest in the workforce here because it's such a labor-intensive area of caring for older adults. So we managed to land the plane here on time, so that's good. We're going to open it up now for questions from all of you, and it looks like.
Hi, thank you. My name is Hannah Kaufman. My background is public health and aging and access to services. I think something that we've been talking a lot around but not addressing directly today is ageism and the role of ageism in every conversation that we're having today. And I'm wondering if you can talk a little bit about ageism and the role it is in your research and in the work that you're doing. But I think we need to call it out in every conversation that we're having. So thank you.
Do you want me to start or do you? Yeah. Why don't I start? I'm so glad you flagged that because it's so important here, and I think I'm always shocked, even in watching. If you watch a late night television show or anything that like things that are said that are ageist would never be allowed in terms of the other isms that we often talk about, and yet ageism is still so prevalent. And I do think it's a big part of why we don't invest in care for older adults. It's not just that there's fear, anxiety, all those issues I listed earlier. Some of it's just that we don't value their care or their caregivers, and so those investments need to be made. And when you compare the U.S. to other countries around the globe, there's just very different feelings about older adults, whether it's countries in Asia, countries in Europe. I'm so glad that you raised that issue, and I think there's a transformation that needs to happen. I don't know if any of the other panel members want to piggyback on that, or.
Yeah, it certainly is everywhere. I was having a discussion with one of the other panel members upstairs in our speaker ready room a couple of hours ago, and we were talking about what is the perception of a barista when an older person walks in. Do they see right through them, or do they recognize them? And some kind of I don't know if it's workforce awareness training or something, I think needs to take place, because the baby boomers are not the first ones to face this, but as usual, we're the loudest. And what we do about ageism is going to ring true for generations following us. So I'm always quick to point it out. When someone calls me sweetie or dear or something, after I get over my initial reaction, I say something to them. I say, why did you call me that? Is it because I look to you like just any generic older person? I mean, I'm not related to you. And I usually conclude by saying it's really offensive to older people to call them by those kinds of monikers. So,
I mean, I think, you could do cultural trainings and all of that within the workplace, but I do think there's changing perception to, view the older generation as, yes, there are these fonts of expertise and talent, and here's where we can learn from them. I think that can go a long way also in just changing, how people sort of perceive others in a workplace, at least.
So just a quick thought. I think it's also related to urbanization. Small towns, you tend to know people. If you don't know people, then it's easier to say sweetie, or in my case, something else.
what would that be, Joe?
Later.
Other questions? Oh, in the very back there.
Hi, Kathy Rowe from New Jersey Advocates for Aging Well. And back in the beginning, when you were talking about long-term care and why people don't sign up for it or don't get it, there's been at least one state, I think it's Oregon or Washington, that was starting a public long-term care program. Do you have any idea how that's working, how people are reacting to it, and what's the potential for that to grow? Because like you said, if it's an opt-out, then people aren't overcoming the stigma and the fear of thinking of their own personal needs for long-term care.
Yeah, no, the Washington program currently is ongoing. They're collecting payroll taxes, setting up the benefit. It underwent. There was a vote last year. There was some opposition. It actually passed and is continuing, but it was like kind of on pins and needles about whether the program would push forward. But it's as of today scheduled to launch. Other states are looking at the model to the other part of your question. Massachusetts, where I live, is one such state. So I think it can serve as a model. I like the way Aparna said it earlier, that it's going to take federal leadership, but there's also an opportunity for states to do some really innovative things in this space. And so I think Washington is a real leader here. So it's super exciting, and I'm sure not everyone in the state is thrilled by the model, but they're pushing forward in a real leadership role.
Yeah.
Yeah, I'm ready.
Hi, you've heard from me before, Vanessa Walker. As we're talking about the economy and autonomy. First of all, I want to give a shout out to Amazon Alexa. This is not an advertisement, but I will say it was life-changing for my 82-year-old mother, who is a solo ager, who lives alone in not near me. And it has been a game changer for her to just be able to say, "Hey Alexa, call Vanessa," or "I need paper towel," or whatever. So yes to that.
Hey, good to hear that.
Yes. The other thing I wanted to mention is that we talk a lot about the workforce and how we need more people in a variety of different ways, but we don't often talk about how much we're paying them. And whether it is peer support specialists, whether it's navigators, healthcare navigators, healthcare advocates within the healthcare system, in-home health aides. These are some of the worst paid jobs in the country. And we talk about how we need this a lot, and I always ask the question, why on earth would anyone want that job when they can work for Chick-fil-A, make more money, get health insurance, and have a vacation? So I would love to know from this panel, what are your thoughts on how we can begin to include that into this conversation about thinking about how are we paying the people that are looking after the people that are aging, and how are we honoring those roles as highly valuable roles that deserve more than a living wage, or at least a living wage.
Absolutely.
Yeah.
And benefits.
No, here. We do not value this workforce. Some of it goes back to your earlier question about ageism. There's absolutely that, but there's some other isms in here as well. The workforce is predominantly women, many minorities, many immigrants, and so there's other isms here at play that we just don't value this group. Some of it obviously relates to the high share of Medicaid payment and that not getting kind of passed through to the workforce. But even on the private pay side, we don't always value this workforce the way we should. And so I love where you're going, and we need ideas. And there are some policies out there like wage pass-throughs or minimum staffing that try to at least put, you've got to put so much of your dollars back into your workforce. But this has been a real challenge that to the extent, there's a lot of parts of healthcare where we're paying a lot. This unfortunately, not a lot of those dollars are going to the individuals doing the direct care. I don't know if it's true.
Yeah, it's a two-edged sword with the workforce, because if we have government mandates that say you have to have X number of workers per bed in skilled nursing, or you have to have X number of employees with these sorts of credentials, then these senior living communities are going to find other ways to cut their costs and be able to live within their means, however that's set up. So yeah, I think it's one of the thorniest situations that we have right now, especially with what's happening with regard to immigrants, because those are our main employees in the caregiving workforce.
And that shouldn't be an instead of, that should be but we shouldn't do this on the cheap. We should pay them a living wage with benefits, and this shouldn't be an either or.
Yeah.
Sorry, you were gonna.
No, I was just saying +1 to that. I don't know is it government regulations? I mean, we are expecting this to be a skilled workforce, and yet there's such huge turnover. We're not seeing higher wages. I don't know where that pass through, like you're talking about, David, isn't happening. Because I do feel like we all pay a lot for getting that kind of care, but somehow those wages are not reaching the people who are actually providing the care. And so, and I see that in childcare as well for some, it's the same workforce. They're doing a really high skill job, and somehow, they're not being paid what they should be paid. So I don't have a solution, but I do see the problem. Yeah.
Well, this is a good issue to end on. I want to say thank you to the panel. This was a great session. Thanks, everyone. Join me.